Good afternoon to some and good morning to some. I know for some of you it's very late at your place. It's past midnight, so it has to be your morning. Well, today's session is really interesting, and this is also by the request of many of you here. So many of you said that yes, you want to know a little more about thyroid, want to know why thyroid and MS are so connected to each other. So we have a doctor here, Dr. Alan, and he is a naturopathic physician and able to help you know more about thyroid and how it relates to MS. So I'm gonna invite doctor here and you can ask a question. Hi, doctor. Good afternoon.
Hey, Ritu. Good afternoon. How are you?
I'm great. I have to say thank you to you for accepting this request, and we are really glad to have you here.
My pleasure. Glad to be with you.
Thank you so much. So there's so many people who really wants to know about thyroid, and we saw that you can really help us know about this and how to control this. So, doctor, if you can just tell us a little about thyroid, but before that, just a small thing I want to talk about you, that seeing your profile, you have suffered with epileptic seizures, obesity, and the rare nerve tumor, and you have really fought with so many things. And still, we see you all glowing and smiling with so much positivity. So, what's the reason behind that?
Well, I guess the reason behind that is nothing that I get credit for. It's just how the body works, when it gets a chance. And that's what's really inspired me, is just knowing that so many things can get better. Even if you thought they couldn't, even if you were sure they couldn't, even if you were at a dead end, that the right information, the right changes, your body can just work miraculous things. So many things can heal. Yeah.
Absolutely, that's a positivity we all look for. People suffer with so many neurological diseases, like MS is one of them. And yes, when the diagnosis like MS comes, people are really shattered and they get depressed, and they really look forward, to something that can help them. And example like you yourself really gives them encouragement to, hold on and keep fighting.
That's right.
When you talk about thyroid diseases, we have seen that there are people who, like for females, it's more common, 3 times more common in women with MS than the normal general crowd without MS. So why is thyroid so connected with MS? What's the reason behind that?
Yeah, great question. And it's more common in women with MS. There's been data showing that general populations, per the type of thyroid disease, it might be 10% or so, but in those that are known to have MS, it can be 20, 25, 30%. It's extremely common, really big overlap. And the thought has been, does one disease cause the other? Does MS cause thyroid disease? And we don't think that's the case, but it seems that once the body is prone to attack itself by mistake in one way, there's a higher risk of it attacking by itself in another way. So the same sort of fundamental errors that can cause the body to attack the myelin sheath of the nervous system can also cause the body to attack proteins within the thyroid.
Okay, so what is a possibility that, if someone has MS and is doing well with all the medications or the kind of diet a person is following, so what's the possibility that a person can get thyroid in future? Is there any kind of benchmark like that?
Well, we've seen that of populations that are known to have MS, thyroid disease is extremely common. It might be a quarter or a third of them. We'll talk more about some of the things that give rise to thyroid disease. It's a pretty exciting time because some people are more susceptible to thyroid disease, but now we know what that means, and we know ways to prevent that and ways to help with that. So it doesn't have to occur, and if it has happened, you can do a lot better.
Okay. So doctor, we have also seen that there are different kinds of thyroids. So what is the most prevalent kind of thyroid which is amongst the MS patients?
Yeah, so the most common types with MS patients are really the same as the common types overall. So hypothyroidism, which is almost always caused by Hashimoto's, is the most common form. And we know that's true for those with MS because Hashimoto's is the most common autoimmune version of thyroid disease. So hypothyroidism, the thyroid's not making enough hormone, the body's not responding to that hormone, and we see symptoms of there being a lack of thyroid hormone. And that can be the fatigue, the easy weight gain, brain fog, more inflammation in the body, mood changes. And that's generally caused by the immune system attacking the thyroid. So when we know that's there, then we say that hypothyroidism is secondary to Hashimoto's thyroiditis. The next two most common conditions pretty well round things out, and that would be subclinical hypothyroidism. Now this is kind of funny. Subclinical means below the threshold of what's clinically evident, so no symptoms. So someone could be symptomatic and have MS. They might have early abnormal thyroid blood levels, but they might not yet have thyroid symptoms. So that's subclinical. And then the last thing that goes in there would be Graves' disease. And that's also autoimmune. That's where the immune attack causes the thyroid to overproduce.
Okay, so doctor, like you said, sometimes you might not have the symptoms of thyroid, but you can. So how can one know that a person is suffering with thyroid?
Well, the symptoms we think about there are ones that are more thyroid specific and also ones that have changed around the time that thyroid blood levels changed. Those are two big indicators. So yeah, unexplained fatigue, especially worse after exercise, inability to lose weight, inability to keep weight off, diffuse even head hair thinning. So that's a big one. Brain fog, changes in short-term memory, sensation of a lump in the throat, difficulty swallowing, some tenderness and discomfort there, menstrual irregularities, irritable bowel type syndrome symptoms. Those are the top several.
Oh my God, you're scaring me. I've been trying to lose a lot of weight since like lockdown. I've not been able to do that. Oh God.
The COVID-15, I think it's called.
Yeah. This thing is ringing now. I really have to get it checked. Okay, so
well, and yes. it is smart to screen. As common as thyroid disease is for anyone that does have MS, it is smart to screen their thyroid function at least once per year.
Once in a year. Okay, all right. So, doctor, I can see one question on the screen. If you don't mind, I can just parallelly take on some of the questions that we're getting from the audience.
Please.
So, Alicia Nokis has written, I have a question. Is the sleeve surgery safe for those of us with MS? Will the surgery cause problems with seizures?
I'm not familiar with that. That's not related to thyroid function.
Yes.
Sorry.
Sorry, Alicia. So we are moving on to the next question. Okay. So, doctor, the next question I want to ask you is about iodine. We have lots of theories coming up related to iodine and thyroid. So how are these things linked together?
Honestly, you can't talk at all about thyroid function without talking about iodine. It's the biggest single factor by far. And my upcoming book is just all about this. There's a lot of new perspectives that have come out in the last few years. So anyone can become iodine deficient. It's possible, and that can cause thyroid disease. However, iodine excess can cause thyroid disease. And what we now know is that those who are prone to thyroid disease, they can't tolerate extra iodine. They're more sensitive to it. And they're less apt to be deficient, but they're more apt to have problems from too much. So so too much is the biggest single driver in the modern world. If we go back to 92, a lot of countries were iodine deficient. 112 were severely iodine deficient. By 2014, there was 0, but there's 52 countries categorized as at risk of thyroid disease from iodine excess. And the US is in that list. Many new countries are. So it's a big issue.
Okay, so how can one know that they are taking the right amount of iodine, and what is the right amount of iodine?
Yeah, so the right amount, that's an easier answer. If someone wants to keep their thyroid function stable, not develop thyroid disease, their whole day's intake should be between about 50 and 200 micrograms. And that's going to be from foods, from supplements, from medications. Cosmetics, skin creams can also contain that. But all things together, you want to stay about in that range. And how do you know if you're outside that range? Well, if you're in the modern world and you've developed thyroid disease, there's a good chance you're outside that range. There's tests that can help if someone's already tried to eliminate iodine. They can test afterward to see if it's helped or not, but there's no good screening tests. There's no good test beforehand. So yeah, if someone has thyroid disease, they can safely start by reducing all the extra hidden sources of iodine.
Okay. So iodine level is something that everybody should take control of. We have heard that you have to maintain iron, you have to maintain a vitamin D and the other vitamin B12. But iodine is something that we have heard for the first time so seriously.
Well, relative to thyroid function, some of the next most studied things can include vitamin D or gluten, and they've had dozens of studies done on them. Iodine's had over 40,000 human studies on it and thyroid function. So it's just almost everything. Everything past that is very small.
Wow. So, doctor, talking about gluten, so people say that if you have thyroid, you should avoid gluten completely. What are your thoughts on that?
Well, so avoiding gluten can often go along with just healthy changes to the diet. Many people cut out gluten and they end up eating a lot less processed food. Now, many have cut out gluten and seen their thyroid function get better. It turns out that processed grain products are the densest source of hidden iodine in the modern diet. So breads, croissants, rolls, muffins, biscuits, when they're made commercially, they have just very high, unpredictable amounts of iodine. Many products can have 600 or 1,000 micrograms per serving. So in many cases, people have cut them out and they've gone much lower in their iodine. Now, celiac is also autoimmune, and there's also an overlap, like there is with MS and thyroid disease, there's an overlap with celiac and thyroid disease. So if someone has thyroid disease, their odds of having celiac are about 2.8 times higher than they would be otherwise. So it's probably worth screening and being aware of that for people.
Yes, which is an eye-opener. Okay, we can see another question, doctor, by MS Warriors, and he has written, how can stress and anxiety affect thyroid levels?
Yeah, great question. Stress, anxiety, they're just chemical traumas in the body. And anything that could go wrong is more apt to go wrong when the body's under a high state of stress. Specifically, they can change the body's timing of cortisol. When we're really healthy and we're resilient, we make cortisol when we wake up and we shut it off as the day goes along. So we've got this daily rhythm that's important to us. When that daily rhythm is altered, our immune system is more apt to attack the wrong things. We can't manage inflammation as well. And long-term chronic stress can alter that rhythm. So it's a big thing. It can be behind almost any symptom or chronic condition.
Yeah, so we say that stress and anxiety, that's the last thing you can even think of. Just stay away from that. You get MS flares because of the amount of stress you take. So that's the last thing that people can think about. Doctor, so there's one more theory which people talk about when it comes to food, apart from gluten. The other thing is the nuts. We say that cashew nuts and the walnuts and almonds, they are very good for your body. What about thyroid? Do they do good with thyroid as well?
They do. There was one big study done in Croatia that looked at how different food categories affected thyroid function. And yeah, diets that were high in nuts, legumes, and vegetables correlated with a lower risk of thyroid inflammation and lower rates of thyroid autoimmune disease. And all the ways in which iodine can be complicated are worse if someone's low in selenium. And Brazil nuts are ridiculously good sources of selenium. So they're great ones to include as well.
Okay. Doctor, when we talk about diet, so nowadays we have so many diets available. We have keto diet, Swank's diet, paleo diet, and vegan diet, and the Waltz diet. And people do get confused which one to follow. So what, would you say can be the best diet for a person?
Well, in terms of thyroid function, that's really about just not getting too much iodine. Other factors for general health, we know a lot about autoimmune disease and tissue hormones. They're called eicosanoids, and they control how much inflammation we make in the body. And they're largely driven by our dietary fats. So fats that we get from fish, from cold water fish, from high omega-3 sources. There's abundant data that they lower chronic tissue inflammation. Fats that we get from Mediterranean type foods, they're pretty neutral. They don't really change inflammation one way or another. And then high amounts of arachidonic acid, fats that are high in arachidonic acid, and also things that are high in trans fatty acids, they make it much worse. So we want diets that avoid those inflammatory fats and have more of those neutral or anti-inflammatory fats. That's probably the next best documented factor that's relevant for chronic inflammation.
Right. Doctor, what are your thoughts on soya products? There's a lot of controversy about that. So what do you think about soya? Is it good to take, or should we completely avoid it?
Well, I've looked in really good detail about how soy foods affect thyroid function and also how they affect breast cancer, osteoporosis, and heart disease. I'm very familiar with those topics. So thyroid function, short version is they don't do anything. Way back when the first infant formulas were made, they didn't know how they had to adjust minerals when soy was present. You know, all proteins bind with minerals in varying ways, like a casein protein binds with iron. So early formulas that were made out of casein, they knew that and they added more iron to compensate. But they didn't know at first how soy affected minerals. So some babies were mineral deficient only because they didn't calibrate that properly. And that led to a lot of the concerns about soy. But that was just in infant formulas, and that was fixed once they just added more. So soy doesn't affect thyroid function. Breast cancer, that's been looked at for quite some time. And we thought, does soy raise the risk for getting breast cancer? What if someone is prone to breast cancer if they've had it before? And probably the most dramatic study came out a few years ago. They had a large group of women who had previously had hormonally sensitive breast cancers, and they had been successfully treated for them. And these women were categorized then in two different groups. One was given a rather high soy diet for many years. One avoided soy. And what they saw was that having soy in the diet lowered the risk of breast cancer recurrence and also lowered the risk of breast cancer death. So we've had data for a long time that soy diets correlate with less risk of developing breast cancer, but now we have data that those who have had breast cancer, it cuts their risk of recurrence and death. So we've also got a fair amount of data about its effects upon osteoporosis and heart disease, and it's useful that way. So yeah, no effects good or bad for thyroid function, but in terms of bone health, heart health, and breast cancer, there's definite benefits.
Wow. See, I can see someone has written, so ms&diet has written that she has also started avoiding soya products. She has stopped all my soya products. So yeah, it has its own benefits too. So okay, I think you can rethink about this. I can see a question by Pity Owl, and she has written, I am a type 1 diabetic since the age of 7 years, was diagnosed with hyperthyroidism at age 12, and now MS in 2017. Will the thyroid diet help me a bit?
Well, it certainly could help your thyroid function. And when I wrote the Thyroid Reset Diet, I wanted it to be just a healthy diet. So there's everything in there is just appropriate, good overall guidelines, but it's very specific for iodine status. That's what's really unique about it. And what happens with it is that many can notice their thyroid function can improve, and many can also notice that they respond better to thyroid treatment. So thyroid disease, there's two things happening, one of which is the gland doesn't make hormone. The other thing is that the body doesn't respond to the hormone. Your body gets resistant to the hormone. And those are the two things the Thyroid Reset Diet can help with. So yeah, people often notice that if they're on thyroid treatment, they need less treatment, they need to have it changed. And if they don't, they often notice that at least it works better, that their symptoms start to improve from it.
Okay.
Yeah,
So,
there's been clinical trials done in the diet in which 70 to 80% of people within 3 months regain normal thyroid function after having pretty severe thyroid disease. So it's very consistently helpful.
Okay. Okay, someone has written a question right now. Sorry, I wasn't here from the beginning. I'm vegan and I eat soya products. So does my brother, cause he eats what I cook, My brother has MS, so is soya. Yeah, soya is good, the doctor has said. So you can have soya. It has its own benefits. Like we had the stories earlier about breast cancer and the heart diseases and the other thing, but it has been improved now. It is fine. It is safe to take. Okay. Um, yeah. I have a question by Saras here, and he's written, can thyroid problem impact gut health?
They sure can. So the thyroid hormone controls how quickly our metabolism works, how fast we make food into fuel. It also controls how we repair our connective tissues, and that's why hair loss can be part from thyroid disease. And the other thing it does is it controls how nerve signals are conducted. And I didn't mention this yet, but so people with MS are more prone to thyroid disease, and if they don't have normal thyroid levels, they can have much worse MS symptoms. And that's because of how the thyroid hormone controls nerve conduction. Now, the other way that nerve conduction is relevant is digestive health. So your brain is talking to the nerves in your intestinal tract, and it tells them how to move and which one goes first and how fast to contract. And if those signals are altered, we can see gas and bloating, constipation, diarrhea. So for sure, any way thyroid hormone levels are not in an ideal range can greatly worsen digestive symptoms.
Okay. Doctor, okay, there's always also things about dairy products. I remember, earlier when we were kids, and there used to be an ad that you should have milk every day. Then we had cereals that, have milk and cereals and gives you calcium and makes your bones stronger and so many things. And we've always learned that, dairy is very important, especially for females, and now people are saying don't have milk, don't have dairy products at all, cut it completely from a diet. What is your personal opinion about such things?
Well, so relative to thyroid function, dairy is the number 2 biggest source of hidden iodine. So they use iodine as a teat sanitizer when they're milking cows. And there's very high amounts of iodine that end up in most dairy products. So it is a dense source of calcium, like you said. However, there's kind of a funny paradox in that the kind of calcium in dairy makes us excrete more calcium. So we need a lot more dairy when we're eating calcium, paradoxically. And that's not to say that we should ignore our calcium needs, because we should not.
Yes.
But if
Yes.
we're getting calcium from plant foods, it can work and we can get by on lower amounts of it overall. But yeah, dairy foods are one of the big iodine outliers.
Wow. Okay. Um, I can see some of the question like Linda has written, she needs a doctor in South Africa. Linda, we can, try to connect later about this. Okay, doctor, can you just tell us a little about the hair fall problem? Lots of MS patients, they complain about hair fall. So is it so someone who is not diagnosed with thyroid yet still is having a lot of hair fall? Or do you think, is it something that, the symptoms are not coming up, but it might be thyroid if it is checked? So why is this hair fall and the thyroid related?
Yeah, they certainly can. And directly, the autoimmunity that attacks the thyroid can also affect the hair follicles. So that's one thing. And then thyroid hormone levels, if they're very low or very high, they can make it to where the follicles are not repairing properly. That's the second factor. Generally, that's more even and diffuse hair loss. It's not like male pattern thinning, and it's not little pockets. It's kind of all over. The other
Yes.
factor is that those prone to thyroid disease, especially women in their 40s and 50s, they're also really prone to have hidden iron deficiencies. So they can be chronically low in iron. And that by itself can also make them more apt to have the hair loss. And then finally, the cortisol abnormalities I mentioned before, if someone has chronic high cortisol levels, that can also make their hair shed more quickly.
Wow. That's really scary because it's just that everybody, I think, most of the people that I interact with nowadays, most of the females, they all complain of hair loss, hair shredding. It has become very common. Sometimes we also believe that it can also be a side effect of the medicines that we are taking, since it's DMTs and they are very strong.
Sure.
But if it's high thyroid, then yes, it has to be
Well, and
really checked.
one more thyroid connection. So those who have thyroid disease, and again, autoimmune diseases cluster together. So those with thyroid disease, 30 to 40% of them have autoimmune gastritis. they also attack their stomach, and they can't assimilate iron very effectively. So even if it's a woman who doesn't have unusual periods, if she does have iron in her diet, but if she has autoimmune gastritis, she'll get low in iron almost no matter what. And then that really worsens the fatigue and the hair loss symptoms especially.
So, doctor, if someone is diagnosed with thyroid problem, and doesn't matter which kind of thyroid, what is the best solution? Is it like medications and food and exercises? What exactly should the routine be?
Well, if they're newly diagnosed, like you're describing, really the best focus is dietary change. Yes, several studies have shown that. One very typical study showed that people who had had thyroid disease for about 4 years and their blood levels were 5 times outside the normal range. They were very, very low. They were not yet on treatment. And they were put on the Thyroid Reset Diet with the targeted iodine levels. And over 3 months, 78.3% of them had perfectly healthy thyroid function. And those that didn't, almost all of them, they weren't yet normal because they were so far off, but they were heading there. They were almost there, but they weren't given enough time. So yeah, those newly diagnosed, a very high percent of them can reverse their thyroid disease just by diet alone.
Wow. And doctor, what about exercises? Does exercises also play a role in this management of thyroid?
You know, I couldn't say enough good things about exercise overall. And yeah, there's not been data saying that it reverses the disease like that, but there's a lot of data showing that it does definitely cut the odds of getting it or improve the symptoms for those who have it. And then also just cut the risk of other chronic diseases. So yeah, easy rule of thumb is an hour a day. Do something for an hour a day. It shouldn't be a hard workout for an hour every day, but each day just dedicate that time to at least do some stretches or light things if you're tired, if your energy is low, or when energy is higher, then do something that's more strenuous. But just make an hour block a simple habit.
Yes, just do whatever you like. If you like dancing, dance. If you like walking, walk. Just work out those muscles. Absolutely. Okay, I have a question here by Erica, and she has written, what about hemochromatosis and Hashimoto's, iron overloaded diseases? Can you please tell a little about this?
I sure can, Erica. So yeah, and I mentioned iron before. So hemochromatosis is a genetic defect in which normally the intestinal tract chooses how much iron to absorb based on how much iron we need. So if our bodies are running low in iron, our intestinal tract should just pull in every little speck that we get. And on the other hand, if we have plenty of iron, we'll let more go. We'll let more just pass through us and not assimilate it. With hemochromatosis, that doesn't work. And you get to where you've got plenty, but you're still absorbing every little speck. Now, Erica, there's a much more common thing called anemia of chronic disease. And this is a case to be a little detailed. So ferritin is one of the blood markers that shows iron status. And if there's a chronic source of inflammation in your body, ferritin levels can be high. And what's happening there is ferritin is stored iron, mostly stored in your liver. And so if your body's inflamed, there are reasons in some circumstances why it helps to pull iron out of your blood. It doesn't always help, but your body often does it anyway. And so in many cases, high ferritin, much, much more commonly, is anemia of chronic disease. That can be fatty liver, one of the more common things. That can be autoimmune disease in general can cause that inflammation. Hemochromatosis is more rare. It can happen. It's more common in those that have Celtic ancestry, Irish, Scottish, Welsh, a little more typical for them. And in those cases, you'll see not just high ferritin, but a high red blood count and a high serum iron. And for them, it's mostly about just blood donation. They've got to get rid of the extra iron. However, if someone has anemia of chronic disease, they don't need to donate blood. They also don't need to take iron. Their main issue is resolving the inflammation. So just from what you said, it's more probable to have the anemia of chronic disease than hemochromatosis, but yeah, both can happen.
Wow. Okay, so I have another question by Wrestle News, and he's written, Doctor, which supplements would you like to recommend to us to take on a daily basis?
Yeah, so for thyroid disease, really what I encourage is overall micronutrients. Every essential vitamin and mineral you can think of is important in some way. there's a lot of specifics. So we mentioned iodine, so you want to avoid iodine because too much of that is harmful. Another one that you wouldn't think about is B6. So B6, the most common type is called pyridoxine HCl. That's neurotoxic for those with thyroid disease. And that can especially be a concern for those with MS. So I encourage, the body takes that and makes it into a second thing called P5P. And I encourage only using P5P, not using pyridoxine B6. So those are like two examples. There's 24 essential vitamins and minerals that are relevant. We've made a daily reset pack, which is just all that stuff for thyroid disease. But yeah, we've converted the B6, we take out the iodine, but each nutrient has a story that makes this a special form or type of it that's unique to thyroid disease.
Okay. I can see in the question by Linda, and she has written, I have 2 small nodules on the right hand side of my thyroid and was told to only have it checked every 3 to 4 years. Is this normal, or should I be more worried and checking them every year?
That's pretty reasonable. That's a reasonable time frame. If they are so small, usually means 5 millimeters or less in terms of diameter. And if there are not other worrisome findings around them, like calcifications or hypervascularity, that's a reasonable time frame. In terms of things you can do to help with nodules, the first one is iodine. It's iodine regulation again. The second thing is body weight. So extra weight, higher insulin levels. When your body is growing in one way, your body will grow in other ways. So nodules can correlate with body weight. And then the last thing is TSH levels. That's the main thyroid blood test. If that gets too high, that also stimulates nodules to grow. So yeah, so keeping the TSH levels on the low side of the safe range.
Okay. Yes. So I have a question by Tivania, and she has written, I take vitamin B complex. Is that a problem?
I do discourage that for those with thyroid disease. They generally do have pyridoxine HCl, that's that B6. They've got very high amounts of thiamine, riboflavin, and niacin, and the amounts are not needed, and they can be counterproductive when they're too high and they're not converted. The B6, I'm sorry, the B6 specifically is a big factor for nerve symptoms for people, for nerve pain especially. Many have far too much B6 in their blood, their serum levels are high, and it can cause burning, numbness, tingling in the extremities.
It's very difficult, doctor, when we talk about MS and people take so many supplements and they have other diseases like thyroid or diabetes, and they have to balance so many diseases altogether, and with the medicines that they're already taking, the DMTs and the supplements, it gets really confusing for people. But what do you think, such taking so many medicines and supplements, how is the future like? Do the body really gets weaker or stronger, or just can't remain the way it is if a person is taking supplements on a daily basis? Can it help to a certain extent?
Yeah, so you certainly can take too many, and there are some things that do take away from what the body does do. There's been thought about hydrochloric acid or enzymes, for example, making the body less apt to form them. Essential vitamins and minerals, when you're taking those in reasonable forms, they don't take away your body's ability to do something because it needs those from outside of itself. But other compounds, they can build up and they can be excessive. There was one paper showing that of people who have acute liver inflammation and acute liver injury, 20% of the time, the cause is just excessive supplements. And it's odd because it's not always even harmful supplements, but even ones that individually are harmless, collectively can work differently. They can act in ways you wouldn't expect. So yeah, I think many can take far too many.
Okay. So, doctor, I have another question about sweet potatoes. Some people say that sweet potatoes is not good for thyroid. So what is your opinion about potatoes?
Well, it's a funny thing, if you think about foods as individual chemicals, if you think about particular constituents in foods, you can make an argument for any food being dangerous for any condition. Because you can take those chemicals out of context and not think about their dosage, and you could be concerned about those in a lot of ways. But whole foods together work very differently than their constituents do, and especially whole foods in the context of other whole foods. So sweet potatoes, some have been concerned about those possibly having certain alkaloids or possibly being nightshades like other potatoes are. But really, foods in general that our ancestors have eaten, we figured out a long time ago which foods are poisonous and which foods are bad. Now, highly processed foods like Twinkies or Doritos, they don't go on that list. But the simple foods that like our grandparents could have eaten, those are good foods. Those are fine.
Okay, that's good. Because there's so many theories, when some people say like sweet potatoes is not good, even broccoli. Some people say that broccoli is not good, such healthy things.
Well, the funny thing, so like broccoli is a great example of that. So broccoli has an insecticide in it called glucosinolate. And
Okay.
if you were to take high amounts of that glucosinolate, it would be the most poisonous thing you could imagine. It would be completely lethal. But the amount of it that's contained in broccoli, the effect is called hormesis. And basically, our body's exposed to glucosinolate in these microscopic amounts, and our liver thinks, oh, wow, there's toxic stuff around, I better work harder. So the net effect ends up being positive. So plant foods have vitamins and minerals. They also have what's called phytonutrients. To be really precise, most phytonutrients are phytotoxins. There's things that the plants make as herbicides or pesticides or fungicides. And the amounts that we're exposed to are actually good for us, and we get a little bit of these things from a lot of different sources on a rotating basis. Our bodies prepare, our bodies become stronger because of that. But yeah, if you were to look at that compound and say, oh wow, that's an insecticide, that's a poisonous thing. Well, poisons are about dosages, and in massive amounts it would be poisonous. But in the amounts that we get in food, it ends up making us stronger and healthier. Kind of like a little bit like exercise. If you asked me to lift 200 pounds, I would be damaged. But if I did, 50 or 100, I could get stronger from that. And that's the same thing.
I can see, people writing broccoli, I love broccoli.
It's good stuff.
Yes. So yeah, you can have everything, but in moderate quantity. Don't do overdoses of anything, right? So someone who's written D South Films has written that I have recently been told I have Graves' disease along with MS, which has caused my thyroid problems. Would you like to give any advice to a doctor?
For sure. So Graves' disease, well, for starters, in Europe, it's often called von Badstow's disease. A lot of those funny names are just the name of the doctor that discovered it way back when, right? So Dr. Grave and Dr. von Badstow found it about the same time. Graves is a scary name. I think it's a horrible name for a disease.
Oh God, yes.
So,
it sounds scary.
Well, it's significant, and it's almost the exact same thing as Hashimoto's. It's basically an attack against the thyroid, but rather attacking inside the thyroid, it's attacking outside the thyroid. So the thyroid thinks it's being told to work when it's not being told to work, and it puts out extra hormone. Now, with Graves' disease, that extra hormone, we call that hyperthyroidism, and the odd connection is that hyperthyroidism worsens the autoimmunity of Graves' disease. So it's a vicious cycle. So if someone can be brought out of hyperthyroidism between 95 to 100% of the time within 18 to 24 months, Graves stops. Graves reverses itself quite commonly. So that can be slowed by either medications or by natural compounds or surgery or radioablation. But if there's some way the thyroid is slowed down and kept stable, Graves often goes away. It cannot be ignored. Graves has to be treated because hyperthyroidism is very dangerous. But yeah, it can do well with treatment.
So yes, get that treated.
Yeah.
I can see a question. This question was raised by Shilpa, and yeah, so this question was about IV iron.
Mm-hmm.
So what about IV iron, and how can that be taken care of?
It can, and that's a good question. I didn't mention that. I mentioned how some people can't absorb iron orally, and that's the answer for them. So they can do intravenous doses. And the nice thing is that they don't need much. When it works well, they might need a few doses every few years, but that can be life-changing for those who have especially autoimmune gastritis, and dietary iron, supplemental iron tends not to work for them. They often do need that.
Okay. Doctor, what is your opinion on keto diet? Since keto is becoming a big fad nowadays, and it is all about eating fat. So have lots of fats and proteins, and you can lose weight in a week, in 2 weeks, you know. So it is more about losing weight thing. But is this good for MS and thyroid? What do you think about keto diet specifically?
Well, I know a lot about its effects on thyroid function and weight loss. And the data on weight loss has shown that ketogenic diets can work for weight loss. However, the question is, do people lose weight when they go keto because they flip some kind of a magic switch or because they eat less food? And so one big study took people and it gave them measured amounts of food. One group was on a ketogenic diet. The other group had the exact same calorie count, but they were on a junk food diet. They had half of their diet from processed carbohydrate and a quarter of their diet from sugar, but it was the exact same amount of food. Now, the weight loss between the two groups was identical, but the fat loss was higher in the sugar group.
What's that?
Yeah, so ketogenic diets can cause weight loss because if they cause you to eat less food, but there's no magic flips that are switched. That's not really part of it. Now, we know this is kind of an odd thing, but insulin is often talked about as if it's a bad thing. And too much of it does mean the body's in a high fuel state in general. But we need some insulin in our bodies. We make it for a reason. And we've known for a long time that if insulin goes too low, the body thinks it's starving and it slows down the thyroid. Remember, your thyroid controls your metabolism. And so, like if your car is running out of gas, you're not going to drive it fast. So if your body thinks you're starving, you slow down your metabolic rate. You shut down your thyroid function. And what we know the most of about ketogenic diets and thyroid function come from studies on children, because most studies on ketogenic diets were from children given it for treating epilepsy. Kids don't get thyroid disease often. The rates are about 0.02%, or about one case per every 1,200 for kids to develop thyroid disease of various types. In children on ketogenic diets, about 27% of them develop thyroid disease. And for some, it's lasting. So we do know that in those cases, ketogenic diets can cause thyroid disease and slow thyroid function for people to whom it wouldn't normally happen.
Okay. Doctor, and what do you think about fasting as an option? Nowadays, people follow intermittent fasting. What do you think? Is it good for thyroid function specifically or not?
Well, so there's thyroid function and there's, again, the weight loss effect. And for thyroid function specifically, people prone to thyroid disease, they can also lose muscle mass easily. And that's back to how the thyroid affects tissue repair. So if they lose muscle mass, they have a lower metabolism and they have a hard time maintaining weight loss. They can regain weight easier. The last largest study was done on intermittent fasting, and this came out about 3 weeks ago. It was the TREAT study. It was published in the Journal of the American Medical Association. And they showed that if someone does intermittent fasting versus lowering their overall food intake, there's no extra weight loss, but there is more loss of muscle tissue. So that's the drawback, is that there can be more loss of muscle tissue. And the question, kind of like keto, becomes, many people have done intermittent fasting, they've lost weight, and that's fine. But the question is, do they lose weight because they timed their food in a special way, or do they just end up eating less food? And it seems like they end up eating less food. And for some, that's a great outcome. But if you're wondering what's most likely to work, in group sizes, there's no advantage of that over just eating less food.
Okay. All right. That's funny, actually. I can see a question by Erica again. She's written, I feel like eating beef with vitamin C might help. Just upping the bioavailability of the iron and assisting the body in assimilation. So she says that she wants to eat beef, and we also have theories about red meat and thyroid. So would you like to say something about this too?
Well, funny thing, there was a theory. There's different types of surface proteins in different mammal species. So there's a protein called 5-NEUGC, and that's one that we make. But there's one called 5-NEUGG, and that's made in most of the mammals that we eat. So cows, lambs, or sheep, pigs, they make a different type of protein than we do. And there was a paper way back when showing that we make antibodies to their protein, and that was more common in those with Hashimoto's. So there was a theory that was forming that maybe in some way mammal proteins were driving autoimmune thyroid disease. But future studies showed it just didn't pan out. It just wasn't known to be a factor. So yeah, not relevant.
Okay. I can see a question by Edri Sandra, and she is written, can you please tell me if lean adults can necessarily have insulin resistance?
If lean, what? I missed part
Lean
of that.
adults can necessarily have insulin resistance.
If people who are lean can be insulin resistant, for sure. Yeah, and as a generalization, we do see it more common in those who are heavier, but to be really precise, it's more about body composition than body weight. So if someone is not heavy, but they have insulin resistance, they generally have too little muscle mass. So we talk about weight or waist. And one of the bigger predictors of that is waist circumference, so circumference around the belly button. And someone could be at a low scale weight, but if their waist is more than half of their height, so yeah, you should be less than half, the circumference around your belly button should be less than half of your height. You know, if a woman's 5 feet tall, that's 60 inches. So if her belly button is more than 30 inches around, that can be a sign of there being some insulin resistance. Yeah.
Wow. Okay. I can see a question by Shilpa. She has written, how to test for autoimmune gastritis.
Yeah, so the nice thing is that there are some blood tests that are easy initial screens. The main one is called antiparietal cell antibodies, and that's the actual antibodies we make that attacks those cells in the stomach. And it's rare to have autoimmune gastritis and have those not be present. So it's almost always, it's pretty good predictive. Now, it doesn't show the severity of disease. There's another test called gastrin, which is generally not there at early stages, but it is there when there's a lot of cells being damaged. And so the general thought is that when someone is screened for it, they get a blood test for the antiparietal antibodies and for gastrin. And if they're both negative, it's unlikely they have the condition. If APA is positive and gastrin is negative, they probably have it at an early stage. If both are positive, they likely have it at a more moderate or advanced stage, and they should also do endoscopy where a doctor can physically look at their stomach.
Okay. So, doctor, we have been speaking for 50 minutes now, and it's close to an hour. So, I'm going to just take the last question which Blanketa has written, because this is the second time she has written it. So, she has
Thank you for your
written, how can
patience.
you... Thank you. So, she has written, how can you tone up having MS and muscle loss?
Yeah. So as a generalization, there's the three biggest factors are just obviously physical activity, and then androgen levels, and then protein status. And I'll talk about all those. So physical activity, ideally, there's a good amount of daily aerobic type activity, and then strength training about twice a week per body part. And ideally, lower repetition, more resistance type strength training. So things you can only do a few repetitions of. The protein can be a really big one for people. So protein, it's very easy to become or to not be protein deficient. Almost no one is going to be protein deficient. But have enough protein for muscle growth takes about a gram of protein for every pound of lean body mass. So you can think about lean body mass or ideal body weight. If someone's heavier than they wish to be, they can just think about what their ideal body weight would be, and then that's how many grams of protein they should get throughout the day. For most of us, that's a lot. We're probably not getting that much. You know, like I'm about 170 pounds. I've got about 150 pounds of lean mass. So I shoot for about 150 to 160 grams of protein per day. And that's a fair amount. But I do a lot of physical training, and if I consume much less protein than that, I will lose muscle mass because I'm older. I'm in my 50s, you know, so that's an issue. So getting the protein. And the last thing is the androgens. So the biggest factor there is making sure that one has appropriate amounts of DHEA and testosterone, and they're not far too low. And then also making sure that cortisol levels are healthy. That's back that same cortisol slope. If cortisol's always high or always low, that'll also break down muscle tissue.
All right. Okay, doctor, thank you so much for this wonderful, knowledgeable session we had today. We had so many questions, and I can see, I'm still getting bombarded with so many questions.
You got a great audience, Ritu. Thank you for having me.
Thank you, doctor, for all the knowledge that you shared, and this has been really a very valuable session for us. So thyroid is a very important subject for all of us to know, with MS and without MS, and how to handle this. And thank you once again for this, your time.
A lot of those things I mentioned, they will be in the Thyroid Reset Diet. That's coming out in just a couple weeks. So yeah, take a peek for that.
So when is it launching, doctor?
That'll be January 19th of 2021. It's up for pre-order right now on Amazon, but it's coming out real soon.
Oh, wonderful. So everybody, I have not mentioned about this. The Reset Diet is written by Dr. C himself, and this is coming, this is already on pre-order on Amazon and will be launched officially on 19th of January. So you can check on Amazon, and we'll be sharing the link of the same too. And probably if you want, you can pre-order it. Yeah. So the link will be on our story today. All right, doctor. Thank you so much for your time once again. It was a pleasure having you here.
Nice to have time with you, Ritu. Thank you.
Thank you, doctor. Bye.
Bye.
Okay, guys, thank you so much for being here with us. I know there were so many questions that were coming up. Thank you, Jelly Legs. Thank you, Claire, for sharing the link of the doctor's Reset Diet book here already. That's really kind of you. Yes, so I could see there were a few questions which were getting repeated. So if you really want to know the answers again, then please you can see the same session on our IGTV, and you'll be able to see the answers of that. And I'll see you again with your required specialist, and your opinions do matter to us. So which doctor you want to meet us, want us to invite next, and what specialty, you can DM us, and we will of course request them to be here. So all right, thank you so much everybody for being with us here again. Thank you. Have a good day.